Hi, I'm Sharum Sharif. Today I'll be presenting to you on the subject of naturopathic as well as homeopathic treatments of eczema. I've been in practice since 2003, graduated from Bastyr. My main practice has been in Kent this entire time. As of recently, I've started practicing in Seattle too on Queen Anne Hill, where I see mainly skin patients. My Kent practice has always been a general practice with emphasis and focus on skin, but the Seattle office is mainly dedicated to treating dermatological conditions. Um, I have, over the years, 20 some years of practice, I've compiled hundreds of before and after pictures and videos of patients with various skin conditions, including eczema. You can view these pictures and videos on both of my websites for the Kent as well as the Queen Anne office. You can see the websites down below. I have presented at the AMP numerous times over the last 20 years, but the talk I gave on homeopathic dermatology in 2018 is relevant to today's talk. So you're welcome to refer to that talk, and you can find that presentation on both of my websites. I've also written a couple of articles on how to treat skin conditions using homeopathy that were published in NDNR, and you can see the links. You can go to the NDNR website and hopefully find the articles. And they're also you should be able to find them on my websites too. So today we're going to talk about why did I pick eczema, signs and symptoms of eczema, how conventional treatments for eczema are almost always suppressive, and you know the complications of suppression. Um, we are going to talk about Organon and Organon's view on skin diseases and how to go about treating skin diseases, diagnosing eczema, um, differential diagnosis for eczema, dietary interventions, nutrients, herbs, topicals, homeopathy. As you know, my main specialty is homeopathy, so I'll be discussing homeopathic treatments of eczema in length. I'll talk about different common skin reaction patterns and pictures and their corresponding homeopathic remedies. I think most of you will enjoy that section, hopefully. I'll talk about pediatric eczema versus adult eczema, um, and some other miscellaneous forms of eczema that are common, like infectious nummular or lichen simplex chronicus. At the end, I'll just briefly touch upon the subject of detox and eczema. And at the end, I'll wrap it up by just sharing the highlights of integrative dermatology when it comes to treating eczema, how you can combine conventional dermatology and naturopathic and homeopathic approaches at the same time. Um, why talk about eczema? Eczema happens to be the leading skin condition in the world. It contributes heavily to a burden of skin dermatological conditions all over the planet. It can be quite challenging to treat eczema. Um, there, um, there are 10 to 20% of children in the world struggle with eczema, and from say 2 to 10% of adults worldwide are afflicted with eczema. Um, the itch that comes with eczema can be severe or unbearable at times. I'm sure you've seen eczema patients that stay up all night and they struggle with the itch and can't sleep. And even during the day, the itch itself can be disabling, let alone just the discomfort of the sensations that you feel on the skin. It can severely limit a person's lifestyle. In children, it can cause all kinds of psychological issues. Adults too, but mainly I see it with children. They feel embarrassed, they get anxious, they don't want to, especially if it's on their face or uh, body parts that are exposed, like say hands and arms, face, neck. Children can feel embarrassed, and it can negatively impact their school and just their social life. So it's a major problem in our society. um, Conventional medical versus naturopathic paradigm on looking at skin diseases in general. As you know, in conventional medicine, the approach is symptom driven and they use drugs to suppress the symptoms. In naturopathic medicine, we're looking for the root cause, and try to basically restore balance and avoid suppressive methods of dealing with the signs and symptoms. Um, I think you all know why steroids are not good, so we don't have to take time talking about that. Skin is a window into our internal health. It's more of it can act as a visible readout of our internal physiology. Signs and symptoms can be an early sign of potentially more serious conditions, and sometimes the end result of some like systemic weaknesses or illnesses, including cancer. Um, Um, we mainly diagnose eczema based on the signs and symptoms. There are really no good blood tests for it. There are no blood tests for it. But you can look at the list of the tests that I've come up with on this slide to help you to give you some ideas as to how to help restore health back to the person who has eczema. Not that any of these tests tell you if the patient has eczema, but let's say if the patient's omega-3 index is not healthy, it gives you an idea of what to do for them. Like maybe you should supplement omega-3s, or if the patient's SED rate is off the chart, it gives you an idea that, oh man, their inflammation is clearly a problem. So you can go after inflammation. Or what if the ferritin is low, the iron, the ferritin levels, that can cause itching. So maybe you need to give the patient an iron supplement if it's warranted, et cetera, et cetera. This is a AI-assisted, clinically verified chart. I have a number of these charts that I had AI assist me in creating, and I have verified the contents. They're all accurate. These are extremely useful charts. Hopefully, you'll find them beneficial as well. So these are some abnormal labs, and as far as the eczema phenotypes associated with each. So you may want to take a look at that. Very interesting chart. Um, let's say low B12, for example, the kind of eczema you see with low B12 would be more like a burning neuropathic kind of an itch in the perianal genital area. And the clinical clues would be tingling, anxiety, glossitis. So that's just an example of one example from this chart. There are different types of eczema. The homeopathic classification is different than the conventional dermatological classification for eczema. As you can see, the homeopathic terms are all old, and most of us don't even know what these terms mean. But later on, I'll show you a slide where you can actually see the modern term for each of these. But these are the homeopathic classifications. These are the conventional medical classifications for different types of eczema, and the key features and common locations for each of them. So for example, this hydrotic eczema, the key features would be small, deep vesicles with intense itch, and you can find them usually on palms and soles and fingers. So it's important to know the common locations of these different types of eczema that can help you diagnose, as well as especially when it comes to homeopathic treatment, the location matters. Eczematous reactions versus eczema. You don't necessarily have to have eczema, be diagnosed with eczema in order for you to be having an eczematous reaction. So you can read the difference there for yourself. There are various types of eczematous reactions. For example, medications can cause eczematous reactions, not necessarily eczema, but an eczematous reaction. Or perioral dermatitis. Some people think that's eczema. It's not, but it can cause an eczematous type reaction. These are different DDXs for eczema. I've seen patients that come in, they're like, my primary care doctor didn't know if I have psoriasis or eczema. That happens a lot. I've seen that numerous times. And I look at it carefully. I'm like, no, that's either psoriasis or eczema. There's a distinct difference between the two. Psoriasis does cause eczematization, but it has its own unique features that you can't mistake that for eczema. Although there are cases where it looks awfully similar to eczema. So if you're not sure, you can always send to a dermatologist and have them have the patient get a confirmed diagnosis if you can't tell yourself. So these are different DDXs that can be mistaken for eczema, like ichthyosis, for example, or lichen planus, etc. So let's talk about naturopathic approaches to eczema. Let's start with diet. The main culprits I find dietary-wise are dairy, gluten, and sugar. And of course, the food sensitivity test is always welcome. Food allergy as well as food sensitivity. So I often do IgG as well as IgE panel for all my eczema patients or skin patients in general. Diet is critical, but I find that it's often not sufficient. Most of my eczema patients need supplements and specifically homeopathic remedies. So omega-3s and vitamin D, probably my top two most favorite supplements next to probiotics when it comes to treating eczema using naturopathic, supplements. Lots of studies on all these nutrients. I'm just sharing one, maybe or two studies for each of these nutrients. So we got omega-3s, vitamin D, and vitamin A, D, and E. Omega-3s are helpful for both the wet as well as the dry kind of eczema. As I'm sure you know, there are two different types of eczemas, distinct types. You can have a dry kind with no fluids coming out of the skin, and then you can have the wet kind where there's exudate discharge coming out of the skin. Omega-3s can be helpful for both. That's really important to know. Vitamin D is helpful for both. Vitamin A is mainly helpful for dry chronic eczema, and so is vitamin E. Same thing. So vitamin A and E is for basically the dry kind. Vitamin D is for wet and dry, and essential fatty acids for wet and dry. And then there are different minerals for eczema. You can look at the list here. Iron is a good one because some people who itch a lot, sometimes I find that the iron level is low. I'm like, well, maybe that could be a part of it. So you should be looking for that, and maybe test patients' zinc levels. Here's a table that kind of summarizes all the nutrients when it comes to eczema. Hopefully you'll find that table useful. Probiotics, again, lots of studies done on the correlation between the use of probiotics and eczema. What if now the patient cannot tolerate nutritional supplements? Do I see that? Excuse me. The answer is yes. Many eczema patients can have they can be intolerant. Many of my eczema patients complain that they just react to supplements. Here's two examples here. One of my patients said when she takes vitamin D, her labia becomes inflamed. And the example two, a gentleman who said that he just cannot take any supplements and he could only eat a handful of foods. So each of these two patients were helped significantly by the appropriate homeopathic remedy. The first one needed arsenicum album, and I could tell because she was so anxious. And the gentleman, he needed graphites, and I'll talk about his case. His name is Art. We'll talk about that later. So let's talk about herbs for eczema. Those are just pictures of some herbs that have been found to be helpful for eczema. You can take herbs internally, as you know, of course, and as well as topically. These are some internal uses for various herbs with the indication for each. And these are some other herbs that can be used topically for indications for each. For example, neem can be used for an oozing kind of a secondary kind of a bacterial infections that can come with eczema. So it's a topical for basically infected eczema. Whereas like over here, all these herbs listed here are used internally. So references for the studies. Just some terminology here. You can have humectants, emollients, and occlusives. Humectants attract water. Emollients soften and smooth the skin, and then you have occlusives that seal moisture in. And petroleum, of course, is a classic occlusive. It's a thick, heavy occlusive. Whereas, like say, aloe vera is a light humectant that attracts water. So we'll talk about how do we use these topicals to help eczema patients. We're going to cover that in the next few slides. When do we use oil for eczema? Apply oil on the skin. You use it mainly for dry and non-inflamed eczema, not weeping eczema, because if you put it on weeping eczema, it can irritate the skin. It can trap the heat and moisture, and it can make the patient itch more. When to use emollients and occlusives on eczema? You use them on dry again, not wet, and that table down below kind of gives you the summary of when to use emollients, when to use occlusives. I have two slides here dedicated to a various number of herbs and how they can be used for eczema, whether you use them internally versus externally. and whether the herb is useful for the dry kind of eczema versus wet. It took me a while to kind of sift through all the herbs and kind of come up with this concise summary of how you can use each of these herbs. Like you hear nettles can be used. Well, how is it? Do we use it internally, externally, for what kind of eczema? So as you can see here, it's used internally for atopic eczema and less helpful for weeping eczema. So this is it took a number of days for me to put this together. So it's a good summary, I think. See, on the second slide out of these two slides, you can see there are 3 herbs that can be used for infected weeping eczema, and those would be neem, olive leaf extract, as well as witch hazel. The rest of these herbs listed here are basically all used for the dry kind of eczema, but those 3 are for the wet kind of infected, weeping, infected eczema, oozing. Okay, here are 2 AI-generated tables that I found helpful. Just I thought about like how are we going to classify these? So I asked ChatGPT to help me put these tables together. Like, give me the internal versus topical herbs and the primary role each of these herbs play. And of course, Chat pops out these wonderful 2 tables that seem totally accurate to me with great detail. So, for example, here you can see pine bark is an anti-inflammatory. This basically used for chronic inflammation. It's not helpful for barrier support. Whereas you look at calendula, it's antimicrobial and anti-inflammatory, and it's used for barrier support. So it's a wonderful table for kind of gives you an idea how to use these herbs internally. Here we have the internal as well as topical classification for various herbs. Okay, so let's talk about homeopathy now. Excuse me. So homeopathic case taking, when it comes to homeopathic case taking, you want to look at modalities as well as concomitants. Those are the top 2 most important things in homeopathy. Signs and symptoms, it goes without saying. You need to know the signs and symptoms. Every doctor does that, every healthcare practitioner. But homeopath, we look for modalities, which means what is the symptom or sign better with, and what is it worse with? What makes it better? What makes it worse? And concomitants are basically symptoms that accompany the skin rash. So let's say if the skin rash comes with anxiety, like if anytime the person is anxious, their skin itches, anxiety would be a concomitant. Those are key, we call them keynotes. When you take a case, you need to pay attention to those. Otherwise, you won't be able to find the correct remedy. Discharges are absolutely key. You need to know the color of the discharge, the texture of the discharge. Excuse me. Acute versus constitutional prescribing. This is a huge subject, as you know, in homeopathy. If you feel like the whole person is out of balance and needs to be treated, then you give them the constitutional remedy. But if you feel like the center of gravity of the case is the skin, then you do acute prescribing. So at the bottom, I've tried to summarize that concept. And we'll talk about that with examples. So these are 2 cases where you do constitutional prescribing, and there are cases on the drdurmnd.com website where I'm going to be talking about these cases later, where we do constitutional. And then here is a few cases where you do acute prescribing. Again, you do acute prescribing when the disease is local, not a constitutional matter. And here are like 5 examples on the website, Dr. Durham ND, where we are doing acute prescribing, even though the person's constitutional remedy was evident to me, but it just I knew it wasn't going to help, or I tried and it didn't help. Either way, we went with the acute remedy, and their skin cleared up. We're going to talk about those examples later on. I'll just take you to my website. So, what do you focus on? You always want to ask, what needs to be fixed? So let's say you get an arsenicum case, an eczema patient comes in, they're highly anxious, and their anxiety is just, you can tell, it's just off the chart. So you ought to be thinking, oh, maybe the anxiety is a part of this. I've had some sulfur patients come in, not many, not all sulfurs have a foul smell, but some do. And so if I get a sulfur case come in and I see the eczema, and it's kind of it's not a terrible case of eczema, the severity of the skin damage is mild. the extent of the skin damage is mild, but I can see that the patient comes in, there's a strong odor to them, and they have the whole constitutional, psycho-emotional picture of a sulfur patient. The smell, I would pay attention to that. The overall smell of the person, or the smell of the lesion. So you pay attention to everything, as always. I had a patient, a child who had a facial surgical procedure done and immediately broke out into a rash. So I gave the patient arnica because the etiology of the case was trauma. So arnica is a remedy that addresses trauma. So I didn't even really care what the rash was about, like what it looked like, the characteristics of the rash so much, but I thought about the etiology. The rash showed up right after the surgical trauma to the face. So when you know the etiology, just give arnica if the etiology is trauma. Um, I have a number of therapeutic books, what we call DDX books, and I use them quite often when it comes to treating skin conditions. I find the DDX books more helpful than the repertory, quite frankly. But there are times when you must use the repertory. So you use all the tools at your disposal. Okay. Um, we have a wonderful textbook here called Textbook of Dermatology for Homeopaths, written by two dermatologists, medical doctors who are also homeopaths in India. And they had a few pages here on case taking, which I thought would be interesting to you. They talk about morphology and how you can prescribe based on the morphological appearance of the skin, or you can prescribe based on the person's constitution or their miasmatic background. So they look at it using those three different lenses. And then for morphological, they have classified the different morphological appearances of eczema patients to these different morphologies and the remedies that they consider useful for addressing each of those morphologies. Same thing as constitutions. Of course, the patient can have any constitution. So these are just some of the remedies that they favor. Miasm is beyond the scope of today's talk, but some patients need a miasmatic remedy using no-sodes. Unfortunately, I won't have time to talk about that. That's a deep and elaborate subject. But it's not often I have to do miasmatic prescribing, but sometimes I do. Okay, so dosing, this is a summary of years of practice treating skin diseases. Hopefully you'll find that slide helpful. How do you dose during acute conditions, like an acute case of eczema versus non-acute? And then as far as 200 Cs or 1 Ms and higher potencies, you should not ever give a bottle of a 200 C of a remedy to a patient to dose themselves. That is, I'm talking for skin conditions, really for most conditions, but especially skin, in particular eczema, because that's not how you treat eczema. It's extremely risky. And if you ever do that, you need to monitor them every single day. So I usually use lower potencies, as you can see. Okay, so how do you prevent aggravations? Well, you got to be wise. Low potencies, low frequencies. That's the best policy, in my opinion. And if a patient has been suppressed using pharmaceutical medications, let's say years of steroid use, and they happen to be frail and sickly, you don't want to give them a dose of whatever remedies you think is appropriate, 200 C, and repeat it twice a day. I mean, you're definitely going to get an aggravation. It'd be unusual if you didn't. So you want to think about all that. And if a patient is aggravated, it doesn't mean the remedy was incorrect. It could be a good remedy. It's maybe it was too strong of a potency, or you dosed it too frequently. Prognosis. Look at Hering's law of cure. Cure happens following Hering's law. Hopefully, you remember that from school. Acute conditions respond within hours to 1 or 2 days, and chronic conditions can respond within days up to at least a week. We're talking eczema and even other skin conditions too, oftentimes. Okay, so let's look at the repertory. Dr. Murphy's repertory here. You have, I don't know how many, that's like 70, 80, and maybe 100 different remedies he's listed for eczema. Clearly, we have a lot of remedies that can be used. The bold, I mean, I pay attention to all the ones that are in capital bold and then the italics. Those are my favorite remedies for eczema, and we're going to talk about them. Okay. You can find, let's talk about the repertory. Like what sections, what chapters in the repertory do you find skin remedies in. And those are just some of the chapters and some of the rubrics. I'm going to be talking about the various rubrics like skin eruptions, crusty, or skin eruptions, eczema, etc. Skin chapping, cracks, skin dry. So the repertory comes to 8 for sure. So if a person has dry skin, look at the dry remedies right there, like Nat mirrors. They tend to be a constitutionally dry type. A bryonia case, you could have a bryonia or arsenicum case. They're all dry. Aluminum. Petroleum, extremely dry remedy. It's probably the #1 dry remedy that I use, especially if the skin is cracked. Dr. Murphy has an extensive series of lectures on homeopathic dermatology that can be helpful, by the way, Dr. Robin Murphy. So here's a rubric for skin itching, and there are 210 remedies listed in it. So as you can see, and nobody said homeopathy is easy, but I'm trying to make it easy. So summarizing the highlights. You want to find rubrics that have 20 to maybe 50 remedies. If the rubric has 200 remedies, it's really not helpful. So like skin eruptions, eczema is too large, but skin unhealthy is a better rubric, but it's got 50, 60 remedies in it. So here's just some more information. So let's talk about skin specific remedies, because sometimes you have to give an acute remedy that's skin specific. And so here I've tried to summarize basically everything I know about the top basically features of each of the top remedies for skin, treating skin conditions in alphabetical order. It's honestly taken me years to be able to summarize each of these remedies into like 2-3 lines like that. As a reminder, let's say look at arsenicum iodatum. That sign right there means greater than. That greater than sign means better with cold. That's what that means. Whereas arsenicum album is better with heat. So the greater than sign means better with, and less than sign means worse with. So if anything is highlighted in yellow, underlined, that means it's important, obviously. So like graphites, honey-like fluid comes out, and then it turns into dried crystals that you can flick off the skin. I mean, that's graphites textbook. So I'm not going to read all that. You can have all this. It's available to you. I can just tell you it's taken me over 20 years to summarize these remedies like that. Caution, most naturopaths just give sulfur for skin, for eczema. I've seen that I don't know how many times. Please don't do that because you could aggravate the patient. Sulfur happens to be one of many remedies that you can use for skin conditions. It's a good constitutional remedy as well as acute. So it can aggravate if you give the wrong remedy. If you give sulfur when it's not indicated, it can definitely aggravate the patient. It's a strong remedy. Okay, so let's look at what some famous homeopaths have to say about eczema. Dr. Boricki here here's some, again, AI assisted table, extremely helpful. According to Dr. Boricki, those are the different features of his top favorite remedies for eczema. And like for sulfur, see, I've highlighted those 3 remedies: sulfur, arsenicum, rust tox. You can see they all have burning sensation. Arsenicum and rust tox, they're both worse with cold, whereas sulfur is worse with heat under the modalities. And then the last column, sulfur is they feel hot, their body is hot, they have a hot nature, whereas arsenicums have a cold nature. Now, what's the distinction between arsenicum and rust tox? Well, they're basically very similar till you get to the end. The last column, you can see arsenicums are anxious, whereas rust tox, it doesn't say anxious. So that could be the one differentiating characteristic between the two, because they both are burned. They have burning eczema. Although rust tox is more has an oozing vesicular appearance, whereas arsenicum is dry. But let's say if you couldn't see the skin, if you had no knowledge of the skin appearance, and just went by the sensations, sensation-wise, they're both burning, they're both worse with cold, they're both restless. whereas arsenicum is anxious, roxox is not. And of course, when you look at the appearance of the skin is totally different. Arsenicum is dry, scaly, excoriated, whereas roxox is vesicular oozing, as we're going to see in the pictures coming up. So this kind of a table, I find it this is like this is a nugget of wisdom here in one chart. And so this is how we can use AI to help us actually putting this chart together. Of course, I've verified every entry and it's all correct. So Dr. Henry, let's see what Dr. Allen says here. He happened to be a professor of skin, and that's his book. Fantastic book. He classifies eczema as follows. You can see that. You can read that on your own time. This is the table I promised you I'd share with you, where you can see the old homeopathic terms on the left and the modern terms on the right. So, for example, let's say eczema siccum on the left, eczema siccum is dry kind of eczema. The modern term for it is xerotic eczema. Or let's say if you know weeping eczema, you have a weeping eczema case and you're wondering what's the old homeopathic term for that, you look up weeping eczema on the right, you go all the way to the left, it's eczema exudativum. So I think this is a very helpful table again, AI assisted and clinically verified. Okay, so these are Dr. Allen's top remedies with the various morphologies. You can hopefully benefit from looking at all those wonderful details listed. Extremely helpful charts here. Say miserium, it says crusted, ulcerated, painful. Or graphitis, thickened, fissured, oozing, or sticky. It's just a beautiful summary of each of those remedies. Okay, so this is basically another table by Dr. Allen, but it's in the first table you got remedies and then the morphology and the different keynotes of the remedies. The second table he's got different types of eczemas on the left with the remedies indicated. Okay, so Linenthal, another huge figure in homeopathy, he's got his favorite remedies. So they all have so much in common. A lot of these tables have similar content. But here's Dr. Linenthal's top remedies for eczema and the guiding symptoms for each. Dr. Burnett, another giant in homeopathy, he's written a book on diseases of the skin. Wonderful, cute little book. He talks about various cases of eczema. I've just listed a few here. Notice that 2 of the cases ended up with a fatal outcome when they were suppressed. So something to pay attention to. You don't want to just casually suppress eczema. See, eczema on the scalp of an infant ended up causing convulsions, which resulted in the infant's death. And then that's case 2. In case 4, severe body eczema suppressed with ointments caused the patient to have dyspnea, progressive dyspnea, which upon autopsy, they found that the patient's heart was ossified. Now, I'm not sure about any of the validity of all this, but it's Dr. Burnett we're talking about. So, all right, another cute little book, and this book has some extra information on eczema you can look at. As an ex-engineer, I love algorithms, so that algorithmic kind of a breakdown there in this book, I think is neat and helpful. This book, The Family Guide to Homeopathy, has a great section on eczema here, and he's broken it down. It's only 1 page, but I am amazed by how much information he's put in here, like compacted, concise, to the point, extremely helpful, I think. It's oversimplified, but it's a good I guess place to refer to if you're stuck. For example, he talks about locations. See, it says eczema on the forehead. He recommends Nadmir, whereas like eczema on the fingertips, he recommends petroleum. Right on. I think that's a really good choice. So behind the ears, graphitis. You're going to see a case of that later. I'm going to show you. Okay. Common skin reaction patterns. So, okay, so this is the part you've been waiting for, pictures. So some of these pictures are from the internet, some are from my own website, patients. So, and I've used the book called The Essentials of Homeopathic Therapeutics by Jacques Jouany, a French medical doctor. So I've basically gotten these pictures from different sources, including books, internet, and my own patients. So this is an arsenicum album kind of a eczema. You can see there's a fine powdery desquamation, like flour on the skin. See right there. It's dry, very, very dry, and you can see fine powdery desquamation. Okay, so this is another kind. They call it elephant skin. It's the second type of arsenicum album situation. There's arsenicum iodatum. I'm just going to flip through these. You can read the writing on your own time. Arsenicum iodatum, Berberis vulgaris. It's more of a mycotic. It has a mycotic origin with circular red lesions. Graphites, extremely common remedy in dermatology. A sticky oozing with fissures and thick skin. The common locations are listed there. Just think yellow crust, oozy, gluey, honey-like discharge, and the skin is thick. So there we go. That's a beautiful picture from the internet. This is another graphitis case. This is my own patient, Art. We talked about him earlier. You can see the before and after. He was disabled by eczema all over the body. And as you can see, the leg has healed. And I gave him graphitis 6C every day for a few months. You can see his hands before and after. He's the one who could barely eat any food. And at some point, I give him a no-sode called Polybal 30C, just one dose. You don't want it with no-sodes, you only give it once, maybe twice. You don't repeat a no-sode over and over again. That's just not what you do. So I gave him 1 or 2 doses of Polybal, and with graphites and various other supplements, nutritional supplements, his skin has healed almost entirely. It took a few months though, after years of misery, and he's basically nearly disabled. Oh, by the way, when he came into the office, it was a warm day, and he literally couldn't be without his jacket, winter jacket. So he ran to the car and got a winter jacket on a warm day. And so when I saw that, I just gave him 1 dose of Sorinum, and that literally ended his coldness. He's never been cold ever since. Just 1 dose of Sorinum, and I think that has something to do with his initial kickoff. We started healing the skin with Sorinum, and then he went to graphites. I know he's a sulfur, but he got aggravated with sulfur, even though he's a constitutional sulfur. Interesting case here. So this is where you do acute prescribing. I knew it was a sulfur case, but his skin looked like graphites. How did it look like graphites? You can't see it in this picture, but you can see it in this picture. So you can see the honey-like sticky yellowish discharge, and the skin is thick and wet. That's a perfect graphites case. So his hands and feet look like that. So I gave him graphites, and he's fine now. He's like 99% fine. I think he's gonna need sulfur at some point to be healed completely. So we're working on that. So Miserium, these are different keynotes of Miserium. Basically think thick crust, it's underlined bold, with pus underneath it. That's what you got. That's the main thing you got to remember. Intense itching and burning as well. Okay, so this is a picture of a Miserium kind of a rash. It looks very much like rust tox, as we're going to see. Rust tox is next. It looks similar to rust tox, but the vesicles contain yellow or brown pus. So yellow or brown pus. Whereas Miserium, no, this is, I'm sorry, whereas rust tox, which we're going to get to rust tox has a kind of a clear discharge. By the way, I had a patient whose entire body looked like that 18 years ago. At the time, I had no idea how to treat skin diseases. So, and he'd been to numerous dermatologists and doctors. Nobody could help him. It's too bad. In retrospect, I really believe he was a Miserium case. These pictures are invaluable, by the way. They're priceless. So this is a patient of mine with severe some doctors thought it was seborrheic dermatitis, some thought it was psoriasis. Regardless of exactly what it was, I think it was seborrheic dermatitis. She had thick crusts on her scalp, and then they would ooze, and the ooze was thick, and so it would cause her hair to mat, as you can see in the before picture. And Miserium completely healed her, and she was desperate. So you can see the Miserium crusts, thick crusts, and there's like, again, some discharge underneath. And Miserium, by the way, has an affinity for the scalp and the head. It's an internet picture of a Miserium case behind the ears. Nitric acid, you see deep cracks that bleed, and they're very painful. That's the keynote, painful. Another nitric acid picture. Petroleum, also deep cracks and bleed, but they're not nearly as painful as nitric acid. Okay. This is a teenage boy's arm, elbow. He was a NADMIR constitutional, but his skin was cracked and it was bleeding. So I didn't bother with NADMIR. I just gave him petroleum. And you can see within 1 week, his arm healed. And then later on, we switched to his constitutional remedy, NADMIR, which is also for people who have dry skin. And that kept the eczema away. Otherwise, he would get this dry cracking and bleeding eczema on and off. And petroleum was a good acute remedy because his skin had the signs and symptoms of a petroleum case, which is what again? Which is deep cracks that bleed. And then later on, when the petroleum signs and symptoms were alleviated and he just had generalized dry skin, at that point we switched to his constitutional remedy, which is NADMIR. Okay, so this is a Ross Tox picture. This is a perfect Ross Tox picture right here with vesicular lesions with pinheads with clear discharge from the book by Dr. Juani. I think it's an excellent picture of a Ross Tox. You can see those vesicles clustered together like that. What does that make you think of? I think of shingles. So Ross Tox is a beautiful remedy for shingles. If you prescribe Ross Tox when the patient has the keynotes of Ross Tox. And what are the keynotes again? I covered that earlier, which is basically it's in the summary section of my, the section where I talk about the top remedies for acute prescribing. Ross Tox would be better with heat, better with motion. Better with heat, better with motion. If the keynotes are present and you see these pinheads clustered together, whatever it is, whether it's eczema or shingles, you think of Ross Tox. There's a Ross V and a Ross Tox. Here's the distinction here. You can read it. Ross V is similar to Ross Tox, but it's denser. The lesions are denser and more extensive. Just want you to get a good feel for these remedies by looking at these pictures. You can have dyshydrotic eczema. That's right there is a picture of dyshydrotic eczema. It's usually basically it's on palms and soles of the feet, intensely itchy and fluid-filled blisters. And Ross Tox or Ross V are perfect remedies for that. This is a case of peribuccal eczema around the basic eczema around the mouth. It's a sepia case. Sepia, one of the main locations where you get eczema in sepia cases around the mouth. Okay, so this is a patient of mine, sulfur constitutional. His name is Michael. When I saw him, as you can see here, you can see the thick skin with yellow discharge, although it's dried up now, but he said that he would have all kinds of yellow discharge. You can see it in the picture on the left, at the very on his heel. You can see a drop of yellow discharge. This is a perfect graphitis case. He needed graphitis, and then once the graphitis keynotes were alleviated, which is that thick skin with honey-like discharge were alleviated, and he just had maybe unhealthy skin. At that point, we switched to sulfur as constitutional remedy. And he hasn't had any more outbreaks at all. He had been hospitalized at least once, I think multiple times, if I'm not mistaken. So graphitis was his acute remedy, sulfur was his constitutional. But see, I didn't start with sulfur. Why not? Because if I had, it would have aggravated him. He had keynotes of graphitis. And so if you see the keynotes of a remedy, you give that remedy. And then once the keynotes are gone, maybe the skin is maybe it's not perfect yet, but you don't see keynotes of a remedy like graphitis or petroleum or sorinum, then you give the constitutional remedy. And in this case, Michael's constitution was sulfur. So pediatric eczema, you want to take pediatric and childhood eczema seriously. Some of the cases can be life-threatening because they can get infected. So here's the chart, AI generated, clinically verified pediatric versus adult presentation of eczema. Just look at a couple of examples of arnica. In pediatric dermatology, it would be for birth. Let's say you give arnica for traumas, falls and bumps, post-vaccine soreness, for example. But for adults, you would think of arnica post-surgery, overexertion-related skin soreness, injuries. I think this hopefully helpful. Gives you an idea of what, let's say, when do you use Miserium for in a pediatric case? Cradle cap is a perfect case where you might use Miserium. Okay. Yeah, for children, usually their eczema is acute weeping inflammatory, whereas in adults it's chronic fissure lichenified. And those are some of the remedies for each kind. Just to mention the common remedies used for each of the, for pediatric versus adult eczema. Yeah, so that's a pediatric. It's a infant. This is a good picture of an infantile eczema. Um, uh, Basically, we're talking atopic dermatitis during this early phase of life, and they call that infantile eczema. It can have exudates. It can get infected, and secondary infection can lead to lymphadenopathy, and they might end up in the emergency room if you don't act quickly. If the child is above 2 years of age, we call that childhood eczema, no longer infantile eczema. Gosh, I've had probably hundreds of children in my practice, unfortunately, who are unfortunately suffering with eczema. It's just heartbreaking. It severely impacts the quality of life. And as you can see, there some forms of eczema in children can be fatal. So you got to take childhood eczema and infantile eczema seriously. Um, and there are times when let's say I've seen that a few times, to say the least, that when a child develops eczema after vaccination. So if that ever happens, you want to think of remedies that can be helpful for reversing any kind of a complication caused by vaccines. And to mention just the top remedies, we have Rostox, Silica, Thuja, and Vaccininum, which is derived from the cowpox vaccine. That's all on the bottom of the slide. Okay, and I want to state the obvious. When would you pick Silica versus Thuja or Vaccininum? You look in the Materia Medica, you look at the keynotes of the remedy and see which remedy best matches your patient. Clearly, you don't randomly obviously pick Thuja because everybody says Thuja is a good remedy for post-vaccine complications. Not necessarily. It could be Silica or it could be Vaccininum. So you need to refer to the Materia Medica to narrow down the choice of your remedy. These are just a few different types of miscellaneous types of eczemas: infectious, nummular, and lichen simplex chronicus. What do they mean? What are the key features? What are the remedies used to treat each one? I've tried to cover some of that here. This is the infected kind. You could have a bacterial infection or otherwise. If it's bacterial, we call those pyodermas. And the choice of the remedy depends on various factors such as the stage, the pain quality, discharge, modalities. It can be challenging. This is dangerous. So infected eczema is not something you take lightly, obviously. So you have to intervene immediately. And what do you use? It depends. We're going to talk about that. So nummular discoid eczema, beautiful picture of that, and some of the top remedies that are recommended by Dr. Gupta from that textbook on homeopathy, homeopathic dermatology. Lichen simplex chronicus, that is not too uncommon, believe it or not. The top remedies would be Rostox and Thuja. They've been found to be effective, according to Dr. Gupta, a dermatologist who's a homeopath. Okay, detox and eczema. I've had many cases of eczema where the patient needed to be detoxed, needed a naturopathic detox, and as you can imagine, accumulated waste and inflammatory byproducts can appear as eczema, even if the patient doesn't even have eczema, or they can certainly cause itching. And we're going to talk about a case here in the next slide. Like John here, he was a sulfur case. I gave him sulfur. I think his eczema, his itching improved by 80%, and then he needed liver and kidney detox to be 100% free of itching. So this is where naturopathic medicine can be a wonderful adjunct to homeopathy or vice versa. I'm biased. I think homeopathic prescribing for eczema patients is more often than not critical. It should be the primary tool, and naturopathic modalities would be complementary. And on rare occasions, you need pharmaceutical medications, which we're going to talk about. Okay, so herbs, as you know, they have an affinity for tissues. So you pick them based on the organ tissue you want to target. Whereas with remedies, you prescribe them based on the pattern that you observe. So this is a good summary here of how do you prescribe, when do you prescribe herbs versus remedies. Homeopathy is all pattern based, as you know. You don't want to ever assume a homeopathic remedy's action from its herbal use. As you can see in this slide, the first four remedies, calendula, arnica, hypericum, and hamamelis, their herbal use and homeopathic use overlap partially or completely, whereas some of the other substances on the left, if they have an herbal equivalent, which some of them don't, the action of the herb versus the homeopathic remedy with the same name are divergent, meaning they have totally different actions going from the herb to the remedy with the same name. And sometimes some of those substances on the left don't even have an herbal equivalent. So for example, let's take Rhus tox. Rhus tox, as I mentioned it here at the bottom, it causes vesicular dermatitis as a plant, yet in potency is prescribed for vesicular oozing eczema that improves with warmth. So it causes vesicles as an herb. However, as a remedy, it is actually used to help vesicular lesions. So it's totally opposite. They have the herb versus the remedy have opposite effects. Whereas calendula and arnica, the herb and the remedy have similar effects. So the take-home message is, if the herb is good for the skin, that doesn't mean the remedy made from that herb would be good for the skin. You have to know what you're doing. You have to look up the indications. So integrative dermatology, this is basically where you combine conventional medicine with naturopathic and homeopathic medicine when it comes to treating skin diseases in general, but eczema in particular. Step one would be, we have 4 steps here. Step one for approaching eczema cases is to ask yourself, is this a severe acute flare? Do you need to stabilize the skin? If so, and the patient is like on their way to the ER type of a situation, you can think of corticosteroids and sometimes calcineurin inhibitors. You might have to prescribe antibiotics. I have rarely ever needed to do any of this, but on rare occasions I do, and I think it's necessary. There are times when the patient is in deep trouble and you need to prescribe steroids, perhaps orally or even topically, and give antibiotics maybe for 5 days, and then you can move on to steps 2, 3, and 4, which is less aggressive sorts of treatments. Step 2 would be barrier support. I love ceramide emollients, and we're going to talk about that for helping build the barrier. The skin health itself is different than stabilizing the skin. It's more like building up the skin. When the barrier is compromised, like you have dry, cracked, inflamed skin, which has frequent flares. That's where you think of barrier support. That's step 2. Step 3 would be basically naturopathic medicine, and step 4, same thing. So steps 1 and 2 are more. 1 would be, you could say, allopathic sort of care. And if you want to do homeopathy for step 1, beautiful. I've done it many times. Acute homeopathic care can actually replace drugs for step 1. For barrier support, you can use homeopathy, naturopathy, pharmaceuticals. Same thing for steps 3 and 4. Steps 3 and 4 is mostly naturopathic, homeopathic. But I think step 2 would be, you can use all of the tools available, pharmaceuticals, naturopathic, and homeopathic. Step 3, again, and 4, I would say they're almost entirely naturopathic, homeopathic. You can certainly use homeopathy for all the steps. And that's one main reason I like homeopathy, because it's not limited to any one disease or condition or any one stage of illness. You can use it during all the stages, acute and as well as chronic. You can use it for all kinds of diseases as well. It's just so versatile. Here's like the following 5 slides are all generated by AI. It's basically for the pharmaceutical approach to treating eczema. I don't use pharmaceutical medications hardly ever, as I mentioned, but sometimes I do. And I think these AI generated slides are very helpful. They kind of summarize it beautifully. There's step one, and then step two. And how do you know you're done with step one and you can move on to step two? Like, that's a good question. How do you stop? When do you know, how do you know when to stop the steroids and the antibiotics and move on to barrier repair? This slide explains that. There's more information here. How do you wean a patient off of steroids and put them on skin barrier support supplements? So, okay. And here's a simple 24-hour structure for steps 1 and 2 when there is no infection. And here's the same kind of a thing when there is infection. Wonderful slides that can be helpful for all of us. Mainly for stabilizing the patient. Remember, there's like 4 steps here. So for steps 1 and 2, again, step 1 is mostly you could say pharmaceutical, the pharmaceutical approach to stabilizing the skin. Step 2 can be pharmaceutical or naturopathic. I feel like I would imagine most of us would have a difficult time knowing when to even when to switch from step 1 to 2, if we even dare to take on a case like that. So these slides are very helpful for that. If you're using pharmaceutical medications as well as natural therapies, in particular homeopathy, simultaneously, that can be that's okay. That's fine. But you need to. It might be difficult. It might be difficult for you to assess what's doing what. So I try to space them out by at least a few days if I can. But if I don't have the luxury, if the patient is in in pain and they're struggling, then I just offer them whatever I think might help stabilize the situation, and I don't worry about knowing what did what. But I ideally should space things out by at least a few days. I almost always start with homeopathy, and I tell them if the severe itch doesn't subside, if the oozing and the pain, if it doesn't go down drastically over the next 24 hours, let me know. So and then we can think of other interventions. This is a summary of basically how you would approach treating skin diseases using a more of an integrative dermatological approach, using conventional medicine, naturopathic medicine, and homeopathy all at once. And again, you can use homeopathy for all the stages. Here's a website that I developed years ago for teaching students how to come up with the top 15 or so most common constitutions. You're welcome to go to that website and use whatever resources are available. There are a lot of patient videos that you can watch that where you can get a sense of different constitutions, like what's a sulfur person like, how do they act, what are the different keynotes, cal-carb, lycopodium, etc. It's taken me years to develop that website. You might find it helpful. There's a 1-day course on there that you can sign up for and watch where I talk about, like for 8 hours, I talk about all these common remedies in detail. These are my homeopathic resources for this presentation, as well as conventional resources. And there's my contact information. So you're welcome to email me anytime if you have any questions about a patient with a skin condition or otherwise. So what I'd like to do is now take you to my website briefly. This is my skin website, Dr. Derm ND. As you can see here, there's all these menus, and under skin condition, you can go to eczema. And then here's I've shared some of these cases with you already, as this is Michael, which we talked about. He was the sulfur person who needed graphites acutely. This is a patient with severe perioral dermatitis. It's not eczema, but it sure looks like eczema. We did liver support as well as the constitutional remedy, which was silica. And in 4 days, as you can see, the skill healed or was about to heal. This is I'm sorry. So this is Michael actually right here. Sulfur constitution with graphites acute. And this is the Miserium case we talked about. I don't even know Michelle's constitutional remedy. I believe she's a sepia case. Recently, I just saw her after a few years, and I believe she's sepia. But with that kind of a seborrheic dermatitis on her scalp, remember the thick crust with ooze underneath. I picked Miserium for her, which she did extremely well with. And She literally had been to I don't know how many doctors, natural as well as pharmaceutical. Um, so let's see, and then we have Art here, and we talked about Art, and his sulfur case that he needed Sorinum at the beginning, and then to get rid of his, remember, he was extremely cold. One dose of Sorinum cured that. He hasn't been cold for the last several months at all, even though it's winter. And then he did well with graphitis. So okay, this is a case of eczema where the person, I did a food sensitivity test. She had numerous IgE as well as IgG reactions. Um, and you can play this little slideshow yourself. She was hospitalized for infected eczema. Her eczema had literally uh, would turn infectious, and she would have to go to the hospital, and they would put gauze all over her face. So food sensitivity testing is what really healed her. I don't think we did any homeopathy or anything else. She just needed to know what foods not to eat. She was eating nuts every day by the handful, and she was allergic. I had an IgE reaction to all kinds of nuts. So this is a case of Isaac's feet and hands, horrible skin lesions all over. It looks like eczema to me, but it's very kind of an unusual presentation. He's a pulsatilla person. This is the before. You can see the before. There's the after. Pulsatilla constitutional type. His skin was affected all over his body, and the keynotes of his skin, the characteristic, the defining features of his eczema matched pulsatilla. I mean, I asked him, I said, some of the keynotes of pulsatilla would be better with fresh air. They are thirstless. They don't usually like to drink much water, even though their mouth and throat, lips can be dry. That's kind of a strange, rare, and peculiar symptom for pulsatilla. They like fresh air. They like hugs. They can be brought to tears more readily than most folks. So he had all of those features, and his skin responded beautifully to pulsatilla, like completely healed. This is a Nat Muir case. In retrospect, he would have probably done better with petroleum for his hands, but back then I didn't know about petroleum, so I gave him Nat Muir and fish oil, and just told him to drink more water. And in 2 weeks, his hands healed. But now that I see his hands after 15 years, I'm like, oh wait, that's he is an admiral, right? That's his constitution, but I think he would have done even better with graphite, not graphite, it's petroleum, the textbook petroleum picture. And this last case here is a gal with severe eczema. You can watch her video here. She talks about how they would give her steroid shots in each finger, one shot per finger every week or something, every 5 days or every week, just to be able for her to be able to use her hands. Her eczema was devastating. I asked her to stop eating cookies and gluten, sugar, and I gave her calcarb, her constitutional remedy, and she completely, I think within days her eczema healed. So that's constitutional prescribing for you. Um, so I think we are done. If you have any questions, don't hesitate to email me. And thank you for watching my lecture. Okay, bye-bye.